அட போங்கடா. Okay, next topic, dialyzer. So I think you all know what is dialyzer, which will be cleaning the blood in your body through the artificial kidney. Okay. This treatment will be taken in the place of kidney failure or kidney failure treatment. Okay. So, hemodialysis, also called as dialysis, is the most common treatment for the kidney failure. So, a dialysis machine is an artificial kidney which going to be clean the blood. Okay. So, what is the use of kidney in your body? Which will be filtering out all the um, unnecessary components present in your blood. Okay, that means it will clean your blood. To get impure blood will be cleaned through the kidney. Okay, so when your kidney fails to do that process, you will be placing the dialysis machine in instead of kidney. Okay, which will be acting as the artificial kidney to clean your blood. Okay, this is the dialysis machine. So during dialysis, blood is drawn from the patient into the dialysis machine, circulated through the machine, and then returned back to the patient. Okay. So during dialysis process, the blood will be taken from the human body to the machine, dialysis machine, and then after cleaning the blood in the dialysis machine, it will be returned back to the patient itself. So here you need two needles to insert into the patient's bloodstream. Okay, so one needle is used for taking the blood from human body and another needle is used for returning back to the patient blood. Okay, so blood will be returned back to the patient. So here two needles will be required for the process. So this is the diagram of dialysis, complete diagram. So here through the blue color needle, you are going to draw the patient blood from the human body and then it will be taken to the dialysis machine. Here it will be purified and then the purified blood will be given to the patient again through the another needle. Okay, so two needles are necessary for doing the dialysis process. So for doing dialysis, you will be maintaining the pressure, saline solution, dialysate. Okay, for doing the dialysis, you'll be using some solution for doing the dialysis process, and then you have to check all the air pressure, venous pressure, na venous venous articular vessel வந்து you have to take the pressure value. Okay, that will be maintained by the dialysis machine. Okay, venous arterial inner. So hemodialysis is normally performed 3 times a week. So 3 times a week you will be doing the hemodialysis process, and the purpose of vascular access is to provide reliable site where the bloodstream can be easily accessed each time. So your vascular access is nothing but uh, the needle which have to be inserted into the human body part will be necessary. Okay, for accessing every time. Okay, accessing means for taking the blood and giving the blood. Okay, that is mean to access. Here we have three major types of vascular access. So there are three types of vascular access. So the three most common types of access are internal arteriovenous fistula, internal arteriovenous graft, central venous catheter. So these are the vascular access. So the part which going to be access your blood, okay, for giving and taking. That has three types. Okay, internal arteriovenous fistula, arteriovenous graft, catheter. Okay, first arteriovenous fistula. So here the surgeon will create a arteriovenous fistula by making a connection between an artery as well as vein. Okay, so through the artery only you are going to blood away from the heart. Okay, so through the veins you are going to carry blood back to the heart. Okay, this artificial connection. So fistula will help to make artificial connection, which will be allowing the vein to become larger and for the walls of the vein to thicken. Okay, which will be called as maturation. So this is nothing but it will make your vein to uh, become larger. Okay, கொஞ்சம் thick இருந்தா தான் you can take the blood as well as give the blood to the heart. Okay, so that making process, that thickening process will be called as maturation. Okay, so a mature fistula. So fistulaங்கிறது ஒன்றும் இல்லை, ஒரு நீடில் மாதிரி. Okay, which will be inserted into the human body, any parts of the human body. Okay, through that you can visit any internal organs of the human body. So a mature fistula makes it easier for the vein to be punctured repeatedly for dialysis. So fistula will be helping the dialysis process to do repeatedly. Okay, maturation typically takes 3 to 6 months to occur, but in rare case can take up to a year. Okay, so maturation process will be done 3 to 6 months or a year. This makes advanced planning for an arteriovenous fistula important. So we have to plan advancedly for taking this treatment. Okay, when a patient is felt to be approximately a year away from requiring dialysis, the patient should be referred for evaluation for possible creation of an arteriovenous fistula. Okay, so if your patient want to take this type of dialysis treatment, he may require some evaluation process. Okay, for creating the arteriovenous fistula in the body. Okay, so after creating arteriovenous fistula, that is mature fistula in the body, then only you will be doing the continue the process of dialysis. Okay, so this will be playing a very important role in dialysis. So arteriovenous fistula is the preferred type of vascular access due to lower rate of infection. So using fistula you can avoid the infection. Okay, clot formation, which will be resulting in longevity than other types of vascular access. So compared to other two types, this will be best in avoiding the infection as well as clot formation. Clot formation na தெரியும், I think blood clot. And then, however, not everyone is a good candidate for an arteriovenous fistula, particularly older patient and patients with small vein. So, this arteriovenous fistula will not be matched for all the patient. Okay, so for older people as well as the patient who having the small vein, சின்னதா நரம்பு இருந்தா அதுக்குள்ள எப்படி என்ட்ரு ஆகும். Okay, this fistula is nothing but it going to be act like a vein. Okay, in the vein you are going to insert this fistula. Okay, upper one you have to have a thick vein. Okay, so in that rare case, this will not be good to all the patients. So this is the diagram of it, fistula. So see here in the hand only, in the hand you will be having many veins. Through that only you are going to send the fistula to the heart. The next graft. So if a patient is not a good candidate for an arteriovenous fistula, an arteriovenous graft is considered. So fistula match of the patient tekella, we go for the graft. Okay. So graft is a piece of artificial tubing, generally made of Teflon or fabric. It is attached on one end to an artery and another end to the vein. So in between the artery and vein, you are going to have the two attachments. Okay.